Dear audience, in the next few minutes I would like to present you my current PhD progress. My name is Anita Gréta Perényi, and the title of my thesis is Assessment of Nutritional Habits of Pregnant Women. I'm an internal medicine resident from the Institute for Pancreatic Diseases, and my supervisors are Nando Rács and Zsolt Meltzer from the Department of Obstetrics and Gynecology. My SMS is Lorenz Privalski. Our vision is to normalize gestational diabetes with lifestyle medicine and nutritional counseling. And our mission is identifying the dietary factors modulating the therapeutic response in this population. In the center of my scientific interest, there's a special interdisciplinary field called dietary supplements. That's why both of our projects are related to this topic. The first one is investigating the efficacy and safety of polyunsaturated fatty acid and vitamin D supplementation on carbohydrate and lipid metabolism parameters among gestational diabetic patients. Just to highlight the importance of this topic, I would like to provide you some background information. Gestational diabetes affects approximately 14% of pregnancies, and it's been associated with a wide range of adverse outcomes. It poses a tenfold higher maternal risk for developing type 2 diabetes in the next 10 years, but short-term adverse events affect the offspring, like macrosomia or premature delivery, or problems with the neonatal adaptation. There are suggestions in scientific literature that a low-grade inflammation might play a role in the pathogenesis of the disease. And omega-3 fatty acids are promising with their anti-inflammatory properties, and they can improve insulin sensitivity and glucose tolerance. Vitamin D, as a fat-soluble nutrient, regulates many cellular functions, and it can have direct impact on insulin action via gene expression. The standard care of gestational diabetes is based on lifestyle modification, but when diet and physical activity are not enough for maintaining the optimal metabolic balance, insulin administration is needed. Our intention is to find further safe and effective substances in the prevention of adverse events related to the disease. Our clinical question is the following: is higher polyunsaturated fatty acid and vitamin D intake better in gestational diabetes than standard care alone? The population will be gestational diabetic patients. The intervention 1 will be polyunsaturated fatty acid supplementation. The intervention 2 will be vitamin D supplementation, and the intervention 3 will be the co-supplementation of the two compounds. The comparator will be standard care alone. Our primary outcomes will be maternal glycemic and lipid parameters like fasting blood glucose and insulin levels, HOMA index or hemoglobin A1C, triglyceride, HDL, LDL, VLDL or cholesterol. The secondary outcomes will be fetal anthropometric parameters, mode of delivery, and maternal inflammatory parameters. Our hypothesis is that polyunsaturated fatty acid and vitamin D supplementation has better effect on glucose metabolism in gestational diabetic patients. The clinical research implication is improvement in maternal metabolic parameters and decreasing neonatal complications. Now you can see the search gave us. The first domain refers to the population, and the second one refers to the interventions. This flowchart shows us the selection process. And during the full text selection, we found 26 eligible full text files and 2 additional with citation tracing. Now we are in the data extraction phase, and I extracted the data from most of the articles, but I'm still waiting for the answer of some of the authors, because I requested some individual patient data. Our second project will be a longitudinal prospective open-label observational study. The title of it is Investigating the Effects of Diet Composition and Micronutrient Intake on Carbohydrate Metabolism Parameters and the Development of Gestational Diabetes. In the relation of this topic, first we need to talk about nutrients. Macronutrients like carbohydrate, protein, and fat provide us energy, while micronutrients like vitamins, minerals, or trace elements are involved in biochemical processes and metabolic pathways, like the enzymatic processes of carbohydrate metabolism. The exact recommended diet composition evening guidelines for managing gestational diabetes remain uncertain. And our intention is to evaluate and compare the energy of nutrient intakes of healthy pregnant individuals with those patients who are developing gestational diabetes, and to identify the primary differences of the dietary patterns of the two groups. For performing this, we are going to use a food frequency questionnaire for identifying the most common dietary patterns. A 3-day food record, or we can call it food diary, performed in each trimester of pregnancy, which is an appropriate method for the estimation of energy and nutrient intakes of the individuals. We aim to assess the participants' anthropometric parameters with calibrated and validated measurement tools. And because physical activity can have huge impact on metabolic health and weight gain, we would like to incorporate a standardized physical activity questionnaire to our measurements. For verifying our measured data, we would like to use serum and urine biomarkers. This flowchart shows us the planned follow-up. The inclusion will be in the first trimester of pregnancy, and we are going to measure the participants in each trimester of pregnancy and to follow them 6 weeks after the delivery. The inclusion criteria is adult pregnant individuals with singleton pregnancies, and the exclusion criteria is pediatric population, multiple pregnancies, patients diagnosed with eating disorders or poorly controlled internal medicine disease. Our clinical questions are the following. What are the most beneficial dietary patterns from metabolic plans? And what proportion of nutrient intakes are provided by dietary intake, by food sources, or compared to dietary supplements? And can higher micronutrient intake have a preventive effect on gestational diabetes? The population is pregnant individuals. The exposure will be various diet with multiple micronutrient supplementation, and the comparator will be no micronutrient supplementation. Our primary clinical endpoint is the development of gestational diabetes based on the oral glucose tolerance test performed in the second trimester of pregnancy. Our hypothesis is that higher doses of micronutrient intake has preventive effect on gestational diabetes. The clinical research implication is positive effect on maternal metabolic parameters. As a summary, now you can see the 2 ongoing projects with their titles and the planned dates of submission. I'm really grateful for your kind attention, and I would like to close my speech with a quote from Aladarsus. The right nutrition is not only a fundamental tool for preventing diseases, but also for their treatment.
Thank you for your presentation. I would like to ask that are there any guidelines which recommend the micronutrient supplementation in pregnancy which is related to the prevention of diabetes?
Thank you so much for the question. I did not find any similar guidelines. In general guidelines, for example, in the World Health Organization, the routinely recommended is only iron supplementation and folate supplementation, and the multiple micronutrient supplementation is still a question.
Thank you.
I would like to ask you that how did you measure how did you follow up how these patients were taking this micronutrient? It was with vitamin, like vitamin for pregnancy, or it was some questionnaire, or they were given to the patients in a dose, or because if it's like a pregnancy vitamin, they can come in like really different doses. How will you deal with that?
Our intention is to evaluate the nutrient intakes without and with micronutrient supplementation, and the high heterogeneity is, according to my impression, is not a problem, because we would like to figure out that does it have any impact or not, is it necessary or not, and we would like to use questionnaires, food frequency questionnaires, and food records or food diaries. That's it.
Okay, thank you.
first I would like to congratulate for you and highlight your presentation, because your infographics and way of visual interpretation was the best I've seen today so far. So this is for the others as well, that remove the text and all the stuff, that focus on the main, focus on the visuality of the slides. And second, this is a remark for all of you, that I saw that you use the word GDM patients. Well, nowadays, if you want to be political correct and submit it in a journal, for example, in the United States, where this is wording is a really serious thing, then you should rather use patients with gestational diabetes, patients with this or that cancer, because it can place a stigma for the patient. This is a general remark for all of you. And for the second study, I didn't understand the study design. I mean, you have really good and relevant questions, but for me it seems like to answer them to make a randomized controlled trial. And you showed us observational trial. So how will you set the patients in this or that group? I didn't really catch that part. If you can.
Sorry, could you repeat the end of your question?
Yeah, so can you tell us the design of your second project? Because for me, an RCT would seem to be more appropriate to answer these questions, but I didn't understand it. What are you planning exactly? If you go back to the design slide and maybe
Yes. We guess that an observational study can be. You are right that a randomized controlled trial can fit these two. But according to the experiences of my supervisors, in a randomized controlled trial, many of the participants can leave the trial because it requires great patient compliance, greater than just filling forms. That's why we chose an observational study design.
I see. So now basically then every patient will tell you that what diet they follow, and then you collect the data prospectively without intervening anything, right?
Yes.
Okay. Sounds good, and ethically it's more easier and feasible probably here. Congrats again, good luck with the study.